Well, when you need medical care, the last thing you want to do is wait.
That's what a lot of people, though, have to do when trying to find a new primary care doctor. It's not as easy as you think. A nationwide study says there aren't enough primary care physicians in the Quad Cities. Fox 18's Ashley Richmond joins us live with more on her investigation into the issue. Ashley?
Jim, Tiffany, for the most part, no matter where you live, establishing medical care with a new doctor takes time. But what I found is that here in the Quad Cities, sometimes simply finding a doctor can be the hardest part. Moving somewhere new or changing insurance companies is already enough of a headache, but when you can't find a new doctor on top of that, it's even more stressful. A 2014 study by Merritt Hawkins, a healthcare consulting firm, showed the average person in the U.S. waited about 19 days for an appointment when looking for a new doctor. So why is that an issue? If you have an urgent medical problem, you can always go to the emergency room. And if you come down with the flu or a minor illness, you can head to convenient care or a minute clinic. But for some people, establishing care with a family doctor simply can't wait. If you need a prescription that's non-emergency, like a child with attention deficit disorder or a parent with chronic pain, you can't wait a full month to see a doctor because your prescription will likely run out. A 2016 study by Avalier Healthcare and the Consumer Healthcare Products Association crunched the numbers on America's primary care physician shortage. The study shows Illinois has 229 shortage areas, including here in the Quad Cities. Iowa is lower at 119 shortage areas, but both states are still on the higher end of the national spectrum.
1 in 6 American families has a hard time seeing a primary care doctor. And if you look at Illinois or Iowa, it's even worse. In Iowa, it's about 1 in 5 families. There's a doctor shortage for primary care physicians. And in Illinois, about 1 in 4.
We looked at the process of finding a new doctor at 2 major QC healthcare groups, Unity Point Trinity and Genesis Health System. At Unity Point, you can look up doctors online, but it doesn't show who's taking new patients. So I called the My Nurse helpline. The nurse on the other end gave me some physician referrals, but when I called, those doctors said they weren't actually taking new patients. I eventually got information on 2 doctors in the QCA who are accepting new patients. The earliest appointment was about a month out. Tricia Fisher is the executive director for Unity Point Clinics. She says the average wait at Unity Point is 16 business days, so about 3 weeks. That's because most of their primary care physicians spend a large part of their day seeing only existing patients.
We want to be able to manage the patients that we have and provide quality care to them, so we don't want them to have too big of practices.
On the Genesis website, it does show which doctors are taking new patients. Only 1 doctor in DeWitt was taking online appointments. If you want to establish care with any other Genesis doctor, you can't just call and schedule an appointment. You have to either go to a clinic in person and fill out a new patient form or request the form to be sent to you, then wait to see if you're accepted. So I went in, I got my new patient form, and it's 3 pages, front and back, asking for things like my name, address, if I currently have a physician, family history, medical history, pretty basic stuff. So I am going to fill this out, turn it back in, and see how long it takes to get a doctor's appointment. I got a call back a week later saying I'd been accepted as a patient, but I had to redo some paperwork before I could schedule an appointment. I'm still waiting to find out when the earliest appointment is, but Genesis Health Group's president, Kurt Anderson, says the average person can expect to wait 2 or 3 weeks. However, there are other options for those needing care.
If they have an urgent problem that's not quite an emergency room visit, but they really need to get in to see somebody, they've got high blood pressure, they're running out of the medications. So some of those things we can still manage in the urgent care setting in the short run while we find you a primary care doctor.
So if the demand or amount of patients who need a family doctor is high, why is our supply of primary care doctors so critically low? A 2010 study from Northwestern University described Illinois as, quote, in danger of being unable to meet even the most pressing healthcare needs. The report says half of residents and fellows who graduate end up leaving Illinois to practice. One reason cited in the study is that the state has a reputation for not being physician-friendly due to its medical liability procedures and high malpractice insurance rates. Another nationwide issue is money.
It's a lot of work to go through medical school and go through residency training to be a family medicine physician, and then going on and doing a fellowship or a specialty may potentially double or triple your income.
And if you think about it, if I'm a medical student, I'm going to come out of school with about $160,000 in debt right out of the chute. And so being a specialist makes sense.
That's why Spangler says giving people access to more drugs like allergy and anti-smoking medicine over the counter makes sense. Another approach that's working for many hospitals and clinics is staffing a variety of healthcare providers.
So we've shifted more to the team approach where we have advanced practitioners in our practices. So PAs or physician's assistants, as well as nurse practitioners working side by side with our physician teams in the clinics.
Healthcare experts also recommend getting established with a primary care physician before you're sick. That way you don't have as much trouble scheduling an appointment when you really need one. Reporting live in Rock Island, Ashley Richmond, Fox 18 News.
Ashley, thank you. A Genesis Health System representative says the medical facility will start using virtual care this spring. Unity Point Health Trinity already uses the technology. A representative at Unity Point sent us this statement in response to this story. We are constantly working to improve access to primary care in the Quad Cities by expanding our footprint and recruiting the world's best physicians and medical providers.
Chief Meteorologist Andy McCrae joins us now. A little chilly today, but overall it was pretty nice weather for the